Good hygiene, shelter in place, social distancing. So the government wants us to shelter in place, maintain social distancing, and practice good hygiene in the worldwide fight against coronavirus. The last one sounds like my mother's advice growing up, so I know about good hygiene, even if I don't always practice it. Washing my hands a bit too quickly or less thoroughly than is recommended, or sneezing into my hands in the past, because it's been a rather difficult to break habit. The other two are new to me and likely to others. The first one sounds like some sort of euphemism for politicians who can't muster the gumption to say martial law. But shelter in place is not a newly coined phrase to sugarcoat government efforts to control its citizens. I first heard the expression shelter in place during news coverage of a school shooting. In the past, people had two reactions when confronted with a threat: fight or flight. With a visible threat like a crazed gunman packing many rounds of ammunition, one can see that neither approach may really work. Fighting him without a weapon of your own will likely add you to the list of victims, and flight from your classroom may simply make you a moving target. Locking the classroom door and sheltering in place, or hiding from the specific danger, may be best for you, especially if you're a young child or otherwise vulnerable person. It's sort of like in those old bomb drills school children practice over and over. For our uses now, shelter in place means keeping ourselves away from surfaces and individuals who may be infected with the coronavirus, whether or not they're experiencing symptoms, as well as preventing us from infecting others in case we happen to have it. So try to think of it as a cautionary staycation and stay put in your home, safe from playing a role in the spread of this nasty virus. Social distancing means maintaining a safe distance from others in case one of the parties is infected. Research shows that the virus is spread through droplets that are exhaled by infected people, but that they only spread about 6 feet. So, if we can stay 6 feet from others, we should be able to minimize our chances of being infected or infecting them. But we should stay further from those who cough or sneeze, because the force with which those droplets are expelled means that they can travel further. How many times have you gotten damp when someone around you sneezes? Well, the coronavirus droplets are so small you can't feel them when they land on you, and they travel much further. Also, don't get so comfortable with social distancing that you stop paying attention to how far you actually are from others. Like when you start drifting closer during conversations, or that you stop using other protective measures such as good hygiene. You could become part of the chain of transmission. Remember, this situation started with just one person 4 months ago, and as of today, there are more than 460,000 cases in 172 regions and countries. The only way we can beat this virus is to work together as a city, state, country, and world. Stay at home, practice good hygiene, and maintain social distancing. We can do this.